rise today to talk on the health legislation amendment bill, and I've just been handed the amendment from the member for Brunswick. I should go to that initially, that I can't see any reason for that amendment. I don't think we should be delaying this bill being passed in this chamber and when it goes to the upper house, but I'm sure other members will talk to that amendment in greater detail than myself. I do want to acknowledge some of the previous contributions, and in particular the contribution from the member for Point Cook and the member for Laverton in their personal contributions, and I do, as I say, acknowledge them and the lived experiences that they've had and how important that is. And I want to thank the Minister for Health and her staff who have worked tirelessly on this bill, and in conjunction with the many key stakeholders, the experts and the people around Victoria to finalise this particular piece of legislation. Of course, the bill, through these amendments, at its core, it will modernise, streamline and strengthen compliance and enforcement powers to advocate for a graduated, proportionate and risk-based regulatory approach by the Department of Health Regulator, aimed at preventing and minimising risk to the health and safety of Victorians, and that's at the utmost forefront of what this bill is all about. The amendments to the Assisted Reproductive Treatment Act 2008 will transfer the regulatory powers to the Department of Health and bolster the compliance and enforcement powers, and to add the strengthening of the compliance and enforcement. The donor conception register will be managed by a new donor conception registrar. And I just want to touch on, health in itself and what this Allan Labor government has done, in particular out in the West, out in my patch, in regard to health infrastructure and the commitment. And I just highlight a couple of health infrastructure projects. The new Footscray Hospital, which opens up next year, 2025, a $1.5 billion build. It's going to be amazing for the whole of the western suburbs, not just the electorate and the surrounding suburbs of Footscray. And I know the member for Footscray is so excited about this particular facility. And of course, in my patch at Melton, we commence building the new Melton Hospital later this year, and the builders have been announced and awarded, and they're finalising plans, and we can't wait to see the start of that build. And of course there will be a maternity section in the new Melton Hospital, and I'm sure the outcomes of this bill, there'll be families that are affected, and we'll work through the new Melton Hospital in the future through that new maternity section. Of course, the upgrade to Western Health Sunshine, a massive upgrade and a fantastic hospital, and the Joan Kerner facility, and of course the Werribee Mercy that the member for Point Cook alluded to. And of course, just under 12 months ago, we opened up a new primary care clinic in Melton to take some of the stress off the ED departments out in the West. So they're just some of the commitments in the West, and to suggest from those opposite at times that we're leaving the western suburbs behind is so far from the being accurate. As I say, there's a lot happening out in the West, in particular with health infrastructure, and it's certainly well needed, and it's being delivered by the Allan Labor government. Of course, the health and safety of Victorians is paramount to our government. An integral part of this is how health regulation works the best to serve the interests of all Victorians, and by minimising any and preventing risk of harm in all forms to health of the community is really important. And just before I came back into the chamber at 11 o'clock, I was at the event, the Parliamentary Friends of Diabetes, and many people, members of Parliament and others, were there hearing about the great work that they're doing in regard to the medical treatments now around diabetes, but also the great research that's being done. And we have many, and earlier in the week, we had the Medical Research Institute come in, and again, right across our health sector, the fantastic work that they're doing in supporting Victorians. So, yeah, really important stuff. Of course, to ensure the effective execution of regulatory functions, regulators must be equipped with a robust best practice toolkit that grants comprehensive compliance and enforcement powers, and empowering them to implement a risk-based and proportionate approach to compliance and enforcement. So minimising harm is at the forefront of the government's mind when it comes to this bill. And there's few amendments pave the way for better compliance, better enforcement powers, and more consistent approach across a number of health regulation schemes, such as the Assisted Reproductive Treatment Act, the Drug, Poisons and Controlled Substance Act, the Health Services Act, the Non-Emergency Patient Transport Act, and the First Aid Services Act, the Public Health and Wellbeing Act, and the Radiation Act, and finally the Safe Drinking Water Act. And I know it was referred to by the member for Yan Yean. This bill ensures that across all of these acts that the powers of the regulator to issue improvement, prohibition, information, document and infringement notices for prescribed offences and to accept enforceable undertakings. This bill recognises that not every situation requires the same notices or the tool to address issues that may arise, and that is why these powers create means for a proactively and appropriate response to non-compliance. So to ensure the effective execution of regulatory functions, regulators must be equipped with a robust best practice toolkit that grants comprehensive compliance and enforcement powers. So Victoria has been a pioneer for such a long time in the provision and regulation of assisted reproductive treatment, and I think it was around about 1980, 1981 when Victoria became the birthplace of Australia's first IVF baby, and it was the first jurisdiction in the nation to establish legislative safeguards for individuals undergoing assisted reproductive treatment with the groundbreaking Infertility Act. And 1981 was an interesting year for me because that's when I started in the ambulance service. So I became a paramedic in 1981. So the timing was quite interesting in regard to the first IVF baby, and I remember it very well. And of course our history in Victoria and championing of the provisions and the regulation of assisted reproductive treatment means that we know the unique challenges and complexities that surround donor conception. And of course donor conception is an increasingly common method of family formation, a really important method of family formation, and families should have easy access to it, should be supported through it, and be allowed to choose in regard to the formation of their family and through this process. And it's not an easy process, as we've heard some lived experiences being raised in previous contributions. And of course, that's why these amendments include additional funding for the appropriate organisations. It's really important that we need to do that and support them with the appropriate level of funding so they can deliver the support and the services that these families that are going through this process in every which way that we can. And it's essential that these families have access to suitably qualified and experienced counsellors that provide both quality and culturally safe counselling for those that require it and want it. And it's a really important part of the process that the potential parents receive that appropriate level of counselling. Of course, the Allan Labor Government recognises that the issues that may arise when it comes to assisted reproductive treatment are not common in other health service areas, and the issues that are unique to assisted reproductive treatment may require specific legal protections. And on the other hand, these changes recognise that the most effective support may in fact be one that fall under the legislated functions. This bill is a really important bill and it covers a lot. It's quite complex in regard to the processes that are involved. We've referred to the Gorton Review and the recommendations that have come out of that. I know there are many families that will rely on the outcome of this bill being passed. And as I said earlier, things like counselling and such as that are very important to the people that are going through this particular process. Once again, I just want to thank the Health Minister and her staff. This is an important bill, and I'll commend the bill to the House.